soon as you hear recording, 5 seconds and we'll stop. Okay? It's like a performance. Good afternoon. This is the HHC Insurance Company meeting. My name is Dr. Michelle Allen, Senior VP of H&H, meeting chair. Thank you for joining us today for the annual meeting of the Board of Directors for the H&H Insurance Company, which is licensed as a captive insurance company in the state of New York. The meeting is now called to order. In attendance are Dr. Mitchell Katz, myself, Dr. Michelle Allen, Andy Cohen present? Yes. Andrea Cohen, General Counsel, and John Elberg, CFO.
We also have Frida Wang from the Board of HHC observing.
Also in attendance are David Chung and Mary Boland, Nancy Gray and Daniel Scott from the AON Insurance Managers. They're attending this meeting virtually. David Chung will provide a brief overview of both the captive and the PPG subsidiaries.
Good afternoon, everyone. Just very briefly, HHCIC and HHC Decisions Purchasing Group are wholly owned subsidiaries of H&H, the system. HHCIC, both corporations were created to address the rising costs of medical malpractice claims in about 2006. So HHCIC issues primary policies to about 312 physicians, primarily OBGYN and in the neurosurgical service, so that they are allowed to apply for excess coverage under the Medical Malpractice Reform Act. So HHCIC issues primary policies in the amount of 1.3 million, 3.9 aggregate to our captive insureds. And the purchase and the issuance of those policies are issued through the HHC Physicians Purchasing Group. We're about to start the annual meeting for HHCIC, followed by the annual meeting for the HHC Physicians Purchasing Group.
Thank you very much. We will now move to the action items. And the first item is the approval of the minutes of November 7th, 2019 annual meeting.
Michelle, we can't hear you very well now.
Thank you.
We heard you well before. Did you move away from the mic?
I actually turned the mic off. I decided that I had nothing important to say.
I see. You sound great now. Thank you.
Okay, but let's move to the action items now that you can hear me. The first item is the approval of the minutes of the November 7th annual meeting, 2019. Do I hear a motion?
So moved.
Second? Does anyone care to second?
Second, Andy.
Is there any discussion? All in favor, say aye.
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 All those opposed, say nay. And the minutes are approved. Our second item is the confirmation of the appointment of the following directors by the Health and Hospitals Board: Dr. Mitchell Katz, Andrea Cohen, John Ulberg, Dr. Michelle Allen, and Dr. Vincent Calamia. The appointment of Dr. Calamia as chairman of the board of directors and the election of the officers of the company. Dr. Vincent Calamia is appointed as president. Dr. Michelle Allen is reappointed as vice president. Andrea Cohen is reappointed as secretary. And John Ulberg is reappointed as treasurer. The reappointment of David Chung as the executive director of the company. The reappointment of Mary Boland as the claims director for the company. the authorization of the insurance of primary professional liability insurance policies to members of the HHC Physicians Purchasing Group, the appointment of Joe Ellen Cockley of AON Risk Consultants as actuary of the company, and the reappointment of Dana Wilson of Grant Thornton as the auditor for the company. Do I hear a motion for approval?
So moved.
Second.
Anyone care to second the motion?
Second.
Thank you. Any discussion? All in favor, say aye.
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 All opposed, say nay. The director, officers, executive director, claims director, actuary, auditor, and issuance of the liability insurance policies have been approved. Next is a motion that authorizes the loan back of premium in an amount up to $3 million to the parent company, New York City Health and Hospitals. Do I hear a motion to approve?
So moved.
Do I hear a second?
Second.
Is there any thank you, Andy. Is there any discussion? All in favor, say aye.
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 All those opposed, say no. The motion carries. We have 7 information items which will be presented by Nancy Gray of AOM.
That's okay.
I skipped something. The final motion is the acceptance of the audited financial statements as of December 31st, 2019. Do I have a motion to approve?
Mary, is that going to be discussed? Are we going to go over that?
Yes, Nancy will be going over that as part of the action item. We have to approve it first.
Sorry, I can't hear
Oh,
you.
hold on. Yes, I forgot to turn on my mic. Yes, we will be, Nancy will be going over them and all of the statements as part of the information items to follow, but we have to approve them.
But do we want to, maybe, can we hold this one until after she's gone over them?
I guess if you want to, yeah, we can. We just have to remember to circle back to it.
Sure, we should.
Okay, unless there's an objection, we're going to move to the 7 information items and come back to this motion for the audited financial statements. So let's move forward with the 7 action items, which will be presented by Nancy Gray of AON.
So Dan Scott was going to present on behalf of these informational items. So
Oh, okay.
I'll turn it over to Dan.
Scott?
Yes.
Dan?
He is there, he's unmuted.
Dan, you're on mute.
Sorry about that. I thought I took it off mute. Number 1, new applications for coverage have been received from 27 obstetricians, gynecologists, and neurosurgeons. As of 9:30, there are 312 active physicians in the program. Primary policies for the current policy year have been issued by the company. Applications for excess coverage through MMIP were filed for 251 physicians beginning July 1 of 2020. The 251 excess, there were 251 excess applications filed. 230 have been deemed eligible to receive coverage, excess coverage through the pool. And it was determined that the 53 physicians already were covered by the plan for excess coverage through other hospitals or carriers. And there are 27 doctors that are awaiting excess coverage through the pool until final numbers have been determined. The second informational item, company was required to sign up as a plan or pool participant of the MMIP in 2007. The company, like all other New York insurance companies providing medical malpractice coverage, opted to be a pool participant. The September 30, 2020 session statements from the pool indicates the company has a net equity in the pool of approximately 1.7 million. And page 23 provides further details of the breakout of the equity by underwriting year, if anyone's interested in looking at that. I was just going to turn to, sorry, the third informational item, review the September 30th interim financial statements. And if you go to page 27, that's the balance sheet.
See, the pages are too far away.
22, 24,
He said 27.
26, 26.
Yep, there we go, page 27. And I'll just hit some of the big numbers here. Premiums receivable are 1.7 million. This is going to be, we estimate the premiums at the beginning of the year, and when we get to year end, we true up to the actuarial estimate. And once the premium has been finalized at year end, that balance will get rolled into the intercompany loan balance. So the intercompany loan balance is same as at 12/31/19 of 90.6 million. We've got approximately 3.2 million of MMIP receivable from the MMIP. Total assets of about 95.5 million. In the liability section, the first two line items are components of the loss reserves, which total about 11.6 million. When compared to the prior year, those total about 10.5 million. So reserves are up about 1.1 million just as a result of new business. In the other one of the other big items, unearned premium reserves of approximately 476,000. That's up when compared to 12/31/19. Basically this will be in line with 12/31 when we get to year end. Right now there's a 425,000 of the unearned premium relates to the direct policy, which will be fully earned by year end. The intercompany payable is about 1.6 million. That's up about 268,000 compared to prior year. That's relating, there was 148,000 in paid losses and about 120,000 in paid G&A expenses. And then in the liability section, total net assets of about 81.8 million. The only change here is the net income of about 76,000 for the year. If we turn to the next page on page 28. Okay, it's skipping ahead, but on page 28, there's just a detailed, the balance sheet is broken out further between the direct business and MMIP business. Yeah, right there, you can see just, if for your perusal, it shows a breakout between the direct business and the MMIP business. But I didn't necessarily want to comment on that at all, just pointing it out there. And then on page 29, here's the income statement. I just wanted to point out gross premiums, about 1.8 million for the year, up about 100,000. Again, we just estimate this at the beginning of the year, and it gets trued up based on the actuarial analysis at year end. So of the roughly 8 million that's written, we've earned about 1.3 million as of 9/30. Interest income is all coming from the MMIP report. That's up about 22,000 compared to last year at 99,000. In the expense section, losses about 1.2 million. It's up about pretty marginal increase, about 64,000 compared to the prior year. Again, this will get trued up at year end based on the actuarial analysis. The rest of it, the other expenses are pretty much in line with prior year. About 20,000 in underwriting expenses and 116,000 in G&A expenses. Total change in unrestricted net assets of about 76,000. So, and then the next page Page 30 just provides a breakout of the income statement, direct versus MMIP breakout, just for your perusal. I wouldn't really have any comments to make on it. And then the next page gives you a breakout of the expenses. Again, those are all in line with the prior year, but if you're interested in seeing the detail of any of those numbers, that's all breakouts provided there. And then the following page is just some supporting schedules to the balance sheet. That was all I had to say on the 930 statements, unless anyone had any questions. Okay. If there are no questions, then the next informational item is to review the business continuity plan. Mary, I know that was sent as a separate handout, so I'm not sure
Right, we weren't planning on reviewing it, it's just the Department of Financial Services requires an acknowledgement that one exists. So this is it. You can review it, it's actually the systems plan, which we are allowed to rely on as a subsidiary of the parent. And I review this every year when Andy and I certify the cyber compliance. But I sent it out to all of you. I'm sure you've all seen it in some way, shape, or form as part of the systems compliance. But it's acknowledged that we have one and that you're aware of it.
Is that it? Do we have more
Yep,
informational
there's,
items?
Yep.
we're on number 5 now.
Okay, so on number 5, there's a chart on page 33. And this just highlights, if you look at the last 3 columns, Cedric has reported 90 open files, 526 closed files. And of the closed files, 41 were closed with payment and 485 were closed without payment. And then there's some other information on here. You can see the total premiums written inception to date of about 112.4 million, about 112 million earned premium inception to date. Total losses incurred inception to date of about 24 million, with a net underwriting profit of approximately 88 million since inception. So that's the big numbers, picture numbers there. Unless there's any questions, I'll move on to the next informational item. Okay, on page 34. This is just, I just wanted to point out, this is a listing of the communications that we had with the state of New York throughout the year. Nothing else really to comment on this. So if we go to the next page, on page 35. This is a listing of the regulatory requirements for HHC insurance. So the first section is a listing of the various reports and filings that were required throughout the year. And I just wanted to comment that the company has made all of the required filings on time. Some of the main items I'd point out, we need to file an annual report by March 1st of each year. Item B, we need to file an annual certification of the loss reserves by March 1st. D, we need to file a captive franchise tax or premium tax return by April 15th. Down I, we need to file an annual license renewal by June 30th. M, we have to file an annual audited statements for the captive by July 1st. So we need to file the parent company audited statements as soon as they're issued. And that was really all I wanted to point out in the reports and filings section. If we turn to the next page, on page 36, this is just a list of the corporate documentation requirements Everything is in compliance with the exception of the two that are listed as in process, which are going to be taken care of by the conclusion of today's meeting. There's underwriting activities. Whenever there's a change in business plan, we need to notify the regulators. We maintain a principal place of business in New York, and we're only writing allowed lines of insurance. Under financial standing, the company needs to maintain a minimum $250,000 in capital, which we're doing. The exam process, every 5 years, the company gets examined. This was last done as of 12/31/14 and took place in 2016. We expect the next exam will be as of year-end 2019. And if it's on schedule, it would happen sometime during next year. The next item is just the policy documentation. All the policies that are issued are maintained by AHPIA. And lastly, we confirm the company's assets are not pledged other than to collateralize its insurance obligations. That was really all I had to say on there, unless there's any questions.
I do have one question, just for clarification on page 35, row K, the COVID-19 inquiries, just a little bit of background. What is that?
So essentially, New York just wanted to know that they wanted to get a better idea of what sort of impact COVID-19 had on the operations of the captive, both from a functionality standpoint and also from an economic standpoint. So we just had to reply to a couple of those requests just to,
So is there a forum or a venue to feed? I think the members of the board and the members of this committee might be interested in what impact COVID-19 did have on our insurance, et cetera. Is there a venue for feedback?
I'm not sure that this is insurance policies in company and the coverage for the doctors.
Okay, I was just curious.
Yeah, no, I know.
So maybe we can follow up, Andy Cohen and I can follow up. She can understand better what I'm asking for and see.
Dan, if you could prepare like a brief, I guess, memo as to what exactly the inquiries were. I assume it goes to our operations as an insurance company and if COVID had any impact on it. But if you could just do just a couple of paragraphs, just briefly explain. Not right now.
Yep. Yeah, I can do
Not
that.
right now, but if you could get that to us for Andy and for Dr. Allen.
Yeah, sure.
Mary, why don't we can follow up after the meeting.
Yeah.
To define it more specifically. Okay, thanks.
Yeah, just to clarify though, I mean, they did send that request out to all insurance companies. I think they were more concerned in regards to traditional type insurance companies than captives. But because we are a regulated captive insurance company, they did require us to respond as well. So the inquiry was more geared toward traditional insurance companies that sell insurance policies to external parties.
Right. The nature of our business, I think, means there would not be much impact.
Thanks. Thank you both.
We need to circle back to item number 4 before we move on, unless anybody.
All right, so if there are no questions on the 7 informational items that were just presented, we'd like to go back to the audited financial statements
Just approve
and a
them.
discussion of that.
Okay.
Or if there's no discussion, if you can present it and then we can have a motion to accept it. And
Okay.
okay,
He just presented it.
thanks, Felicia.
Yeah.
Motion to accept the, yes, go ahead.
Okay. Did you want me to go through the audited statements first before you? do that motion or?
I would think that's why we did this.
Yeah, if that, well, he kind of did it both because he
Okay.
did 2019 and 2020.
Yeah.
So does anyone want Dan to briefly go through the 2019 statements?
I don't see any need. It looked pretty stable to me.
Okay.
Thanks, John. So is there a motion to accept?
So moved.
Second.
Yes.
Okay, great, thank you. Any discussion? All in favor, say aye.
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 And all opposed, say nay. Great, the motion carries.
Okay.
Is there any other news, business, or matters to be discussed? And not hearing of any other business to be discussed, this meeting can be adjourned.
Thank you.
Thank you. One more.
Thank you, everyone.
Now we can get.
Okay, now we're going to move to the annual meeting of the Board of Directors of the HHC Physician Purchasing Group. This meeting is officially called to order. In attendance are Dr. Mitchell Katz, Dr. Michelle Allen, Andrea Cohen, and John Olberg. Also in attendance at this meeting are David Chung and Mary Boland, Nancy Gray and Daniel Scott from AON Insurance Managers. They are attending virtually from Vermont. The first item is the approval of the minutes of November 7th, 2019 annual board meeting. Do I hear a motion?
So moved.
Second? Andy or John, do you want a second?
So second.
Okay, great. Any discussion? All in favor, say aye.
Aye.
Thank you. All opposed, say nay. Great, and the minutes thus are approved. We're going to move to the second item, which is the confirmation of the appointment of the following directors by the Health and Hospitals Board. Dr. Mitchell Katz, Andrea Cohen, John Olberg, Dr. Michelle Allen, Dr. Vincent Calamia. The appointment of Dr. Calamia as chairman of the Board of Directors. The election of officers of the company. Dr. Vincent Calamia is appointed as president. Dr. Michelle Allen is reappointed as vice president. Andrea Cohen is reappointed as secretary, and John Olberg is reappointed as treasurer. Do I hear a motion to accept?
Move to accept.
Second? Anyone wants to second the motion?
Second.
Andy is nodding her head.
And John.
Any discussion? All in favor, say aye.
Aye.
And all those opposed, say nay. No one is opposed, and the motion carries unanimously. There are two information items which will be presented by Nancy Gray of AON or Mr. Scott.
I can handle those.
Is Nancy?
This is Dan. I can take us through those real quick. First information item. The purchasing group has been registered and approved by New York State Department of Insurance to act as a purchasing group within the state. The business of the group is to obtain on behalf of its members who are employees of the healthcare system's affiliates primary insurance for medical malpractice from HHC Insurance, Inc., a captive insurance company. Informational item 2. The physician members of the group have obtained primary medical malpractice coverage in the amount of $1.3 million per occurrence and $3.9 million in the aggregate from the captive insurer for 2020. Insurance policies have been issued for the members of the group by the captive. The members of the group have also received excess coverage in the amount of $1 million per occurrence, $3 million in the aggregate from the MMIP.
Sure, we're having a hard time hearing you, or at least I am. Sorry.
So that was the end of the informational items for the purchasing group meeting.
Michelle, you have your speaker on?
I do now.
Okay,
Still
great.
here.
Okay, good.
Want me to sit here for a minute?
All good.
Meeting has been adjourned. Thank you, everyone, for participating.
Should I?
Okay, great. Thank you. Cabinet at 2:30, everybody.
Thank you.
Thank you.
Thank you, everyone.
Virtually.